Hi, my name is Elise Adams. Welcome to today's webinar, the Aging Initiative Pilot Project Grants Informational Webinar. This webinar is coordinated by the Aging Initiative, which is an NIA-funded initiative that bridges the expertise and the leadership of two powerhouses for research on multiple chronic conditions. They are the Healthcare Systems Research Network and the Claude D. Older Americans Independent Centers, or PEPR Centers. The Aging Initiative is led by Dr. Jerry Gerwitz at University of Massachusetts, Myers Primary Care Institute, along with co-PIs Jay Magaziner and myself. Before we get started, I needed to cover a few technical details. Due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. So unless you are logged in as a host or panelist, your line is currently muted. However, we welcome and encourage audience participation using the Q&A and chat features of the webinar software. If you are in your Cisco webinar portal, look at the row of circles across the bottom of the screen. Click on the chat bubble icon until it is highlighted blue. If you have questions for our speakers, please click on the Q&A tab on the right side of the screen and type it in the Q&A box. We will keep an eye out for those questions under the Q&A icon as the webinar continues. As time permits, we will read questions for our speakers after the presentation. If you have technical or logistical questions, we ask that you submit those using the chat box that is available in the Q&A box. Please make sure you are identified by either name or participant ID so our webinar host will be able to help you and troubleshoot for you if you have audio or other issues. With the chat function, you can choose whether you'd like your comment to be visible by all participants, or you can choose to send the question only to the hosts. We extend a huge thanks to Catherine Anzoni and Chris DeLude at Myers Primary Care Institute, who do amazing work behind the scenes to make these webinars possible. They will be monitoring the chat functions today to help with technical troubleshooting. I would like to introduce pilot co-leads of the Aging Initiative, myself and Dr. Elizabeth Bayless. I am Associate Director of Healthcare Delivery and Policy at the Division of Research at Kaiser Permanente, Northern California. Dr. Liz Bayless is a Senior Investigator at the Institute for Health Research at Kaiser Permanente, Colorado, and a Professor of Family Medicine at the University of Colorado School of Medicine. So with that, I think we can go to the webinar slides. So the first question, or to start off the webinar, I wanted to talk about a little bit what the pilot projects are and are not. So the pilot project grants are one-year pilot projects focused on multiple chronic conditions that support activities that will increase the likelihood of successful future grant proposals. Up to 4 grants not exceeding $40,000 will be awarded, and we welcome all types of research projects as long as their focus is a focus on multiple chronic conditions. Specific examples can be found in our previously funded pilot awards, and there's an example at the bottom of the page. Next slide, please. We are going to require a letter of intent, and that letter of intent is relatively brief. It's a one-page specific aims plus your NIH format biosketch. And that helps us a lot because it helps us assess whether or not your proposed research idea fits with our criteria. And our criteria include that the study is relevant to older adults with multiple chronic conditions, that it leverages OAIC-related data and or the unique features of the HCSRN and its data. And we also consider the likelihood that the project team will reflect a new collaboration between OAIC and HCSRN investigators. We also consider whether the likelihood that the proposed study will be completed within 1 year, which is a time frame for the pilot grants. The LOI submission due date is January 10th, 2020. The invitations sent for full applications go out January 24th, 2020. So based on a review of the LOIs, we review those on January 24th. And finally, the full applications are due by invitation only on March 24th, 2020. And let me pause for just a moment to ask Catherine and Chris if folks can hear me okay.
Yep, I think we can hear you all set.
Okay.
Yep, I can hear you, Elise. Sounds good.
Great, sorry. Wonderful. So again, so the LOIs will be reviewed by us to assess whether they meet all these criteria. And during that period, I'll talk about this in a minute, we'll also talk about helping to connect investigators if you're having trouble putting together your investigative team. And then we'll let people know if we want full applications on January 24th. We will only accept full applications for those LOIs which we have invited to submit a full application. Next slide, please. The application requirements are that the principal investigator on the application must be affiliated with either the HCSRN, a research center with the HCSRN, an OAIC, or be a current or former Aging Initiative MCC Scholars, and that's part of our Scholars program. Applications must include collaborating investigators from both the HCSRN, Research Center, and an OAIC. But full specification of the study team is not required for the LOI. We only need to know the PI for the LOI. And that's because we can help you to facilitate making connections among the investigators in either the HCSRN or the OAIC as needed. The application must involve at least one early career investigator on the team. That person may be principal investigators, and we encourage that, but it's not required. And an early stage investigator is defined as not having received a major grant from NIH, AHRQ, or PCORI, or equivalent, such as an R01 activity. They can have a current career development award, such as a K program award. We do consider those individuals to be early career investigators. So if you're on a K, you are eligible to apply. Finally, approval from the IRB at the appropriate institution will be required before funds will be released. Next slide, please. I think this, Liz, I think this is you, unless you'd like me to continue.
I'm good. Here we go. So you can see here the format that is going to be required for the submission, not for the letters of intent. And it's basically an NIH format, R21 size, proposal. The Ames page is the first page, and then the research plan is allowed to be 6 pages. In addition to that, there should also be a face page, and the template for that is going to be found on the website. And Catherine or Chris or Elisa or I can steer people in that direction when the time comes. The proposals do need to include a human subject section and biosketches in the new format. Well, the review committee realizes that biosketches for early career investigators are not going to look the same as biosketches for more established investigators, and that's totally fine. For example, the paragraph in the bio that talks about goals can be more focused on the individual's career goals rather than accomplishments, and that can be done in conjunction with mentorship if need be. You can see the budget there. The total costs are $40,000, which includes the institutions taking their federally negotiated indirect rates out of that $40,000. So when applicants are invited to submit full proposals, they should work with their grants and contracts administrators to figure out how the 40 is going to match their needs. That can be articulated obviously in the budget justification and the indirect costs checklist. So it's kind of a standard package. It seems like a lot for a fairly small grant. However, it does, I think, help the applicants and the grant proposal articulate the work that's going to need to be done. Let's see, go ahead to the next page. Here are the review criteria that are going to be used for the full submissions after the letters of intent have been reviewed and the full proposals invited. Obviously, we would like to have the proposals address needs of older adults with multiple chronic conditions. That's the umbrella mission of the entire enterprise. Likewise, leveraging either OAIC data or HCSRN features and data. Obviously, the proposals are expected to be methodologically rigorous. They are expected to be completed with 1 year, and they are expected to lead towards a future research proposal of some kind. So this could be pilot work for a subsequent R-level submission, or even pilot work for a subsequent K-level proposal. For those of you who were familiar with the review criteria from last year, because this is the second round of these pilot projects, there was mention last year that there had to be a very specific planned subsequent research proposal with aims for a subsequent proposal. That is not included in this. However, we still anticipate that this work's going to lead to a next project. Elise, do you want to add anything to that while we're on this page?
No, I think that was perfect. Again, as Liz stated, we're not requiring sort of you to articulate that next project in the application, but obviously the idea is this should be spurring additional opportunities for you to write additional work. Hopefully it serves as preliminary studies to a new application. So we're hoping that that will be the outcome, but it's not a requirement for you to articulate that next study in the current application.
Great. And then the proposals will be reviewed by 2 reviewers each. And then discussed with the full review panel. And then you can see the timeline for all of this set out here. There's about 2 months in between invitations for full applications and the submission, which is, I think, we hope sufficient time to write the proposal that people want to write, but also short enough to keep the ball rolling and to likewise have the reviewers keep their piece of it going. So that the start date can be promptly in the middle of June. And then the application form can be found at that website. So you go ahead. This is more information on websites and access. Chris, who has helped organize this webinar, and many of you may have been in touch with him, can also help answer questions, and he can also funnel questions towards Elise or myself or anybody else. I think one thing that's also worth mentioning, and Elise, you said this earlier, which is that the letters of intent can, and the process for reviewing those letters of intent back in January can serve as a bit of a clearinghouse process for people who have a proposal idea and a partial team assembled, but don't have a full team that comprises OAIC plus HCSRN investigators. So having a full team should not preclude submitting a letter of intent. And if the letter of intent is favorably reviewed, then our committee can help do a little matchmaking and team building for applicants. Elise, do you want to mention the other change in criteria about MCC Scholars? I don't know if anybody in this group would find that relevant or not.
No, I think we're just calling out that we'd love applications from MCC Scholars, and unlike the prior application where the PI had to be an early stage investigator, in this particular round we're not requiring that. So as long as an early stage investigator is involved, they don't have to serve as PI, and we're really hopeful that that will stimulate applications from MCC Scholars or even groups of MCC Scholars who want to work together. So we're really hoping to get applications from those individuals as well as others on the phone.
Chris and Catherine, I don't know whether you'd like to unmute folks or whether you'd like to use the chat function, but Elise and I are both happy to answer any questions that we can.
I think if anyone has any questions they want to raise, feel free to either use the chat function or just let us know in the chat function, and we can certainly unmute you if you think that makes sense.
Jerry, is there anything you'd like to add? If you're still on,
I think he's on. Oh, yeah.
Okay.
Okay.
I think Jerry is on, but while we're getting him unmuted, there is another question that's come up about if we could circulate the slides. So please feel free to either send us a chat or an email, and we'll be happy to send those, and we'll also post them on our website with our FAQs. So we're happy to share those.
And I believe I see one question that just came in. Someone said they're not a member of the HCSRN, but they're wondering if they can apply to submit an LOI still, even as a non-HCSRN member.
Yeah, so I think the criteria is that you have to be affiliated either with HCSRN or with one of the Pepper Centers. So affiliation with either one of those entities would make you eligible. So you don't have to be a member of both. So I think for that individual, the question is, are they a member of either of those groups? And if so, then absolutely yes.
And I see one more. What is included/excluded from the definition of a chronic condition? Does that include things like mental illness diagnoses?
Absolutely. Yeah, and I know we have several people who are very interested in mental health diagnoses in combination, particularly with other types of chronic conditions like diabetes and cancer, et cetera. So yes, it sort of includes whole mind and body, right? So mental health conditions are included, serious mental illness, addiction, and any of the usual sort of panoply of conditions you can imagine, as long as you're focused on multiple chronic conditions. So we're less interested in applications that only focus on a single condition, because we're coming at this from a whole person perspective. And from that perspective, we want to look at people with multiple chronic conditions because that's the majority of people, especially older adults. I should also note, too, that we now have an established patient caregiver council who will also be involved in reviewing the full applications, and we're so excited to have them involved because they will be reviewing the applications for a sort of patient and caregiver perspective on these issues, and so I would like people to sort of keep that in mind as they develop their applications. We really want this research to have import for those who were most affected by these conditions. Those questions.
Anything I could add to that definition of multiple chronic conditions is that it may include geriatric syndromes that are not necessarily itemized as diagnoses, such as cognitive impairment, that sort of thing, functional impairment. So that could and should and certainly may be incorporated into the MCC definition.
A great addition, Liz. Thank you.
And I believe someone has their hand raised, Siobhan Mingo, so I'm just going to unmute them now in case they want to ask their question live.
Hi, yes, I was, can you hear me okay?
Yes, we can.
Yep, we can hear you.
Okay, perfect. I had a question about being a member of the either of the agencies and organizations, and if you were saying that you could assist in fostering connections if you had a strong proposal. And my second question is whether or not behavioral interventions or clinical trials, any kind of behavioral intervention research, is that restricted?
Those are great questions. I think the first one, are you asking if you're not a member of either organization? Is that the question?
Correct. Correct.
Okay. So I would say if you're not currently affiliated, so the PI must be currently affiliated with either of those organizations. And one of the reasons is we want people to be able to leverage those resources, and that's very difficult to do from the outside within a one-year period. Right, and with such a short budget, small budget. So I would say if you're familiar with the organizations and there's a PI within either of those organizations with whom you could collaborate, and I'm happy to have that conversation with you, that would be one possibility. But the second question I think is a great question, and I think any kind of trial or intervention would just be beyond the scope. And so Jerry or Liz may have some additional things to say here, but that's primarily because it's such a small amount of money. Because you're talking about indirects and directs for 40,000. So that's a very small amount of money. The other thing, too, is it's only 1 year. And as you know, those things take a lot of work to to put together. And to be able to do that within 1 year, it doesn't seem feasible. However, if you have a great idea for a trial and you need to generate some data that would help you understand how to build that trial, then certainly that kind of feasibility or pilot work that would help you sort of come to that place where you could actually develop your intervention. Absolutely, that would fit. But a trial or intervention, it's just not feasible given the scope of what we're looking at here. But is that helpful?
Oh, that's extremely helpful because I think I was thinking more along the lines of just the intervention pipeline altogether, so not necessarily a full trial, but I know sometimes with NIH, if it is any type of pre-post or any of the formative work, that sometimes there are restrictions against that, and so that's what I was wondering, whether or not, like the feasibility or some of those preliminary questions that, like you said, set up that process for the next step to move forward with the trial. Sometimes you need that preliminary data, but without having an opportunity to kind of do that formative work, I didn't know if there were restrictions around that. So that was extremely helpful.
Good, good. And I think the other thing to keep in mind, too, is if you're not currently in the HCSRN and the OAICs, but you're working with somebody, for example, in those organizations to develop some of this work, keep in mind that these are not, I don't want to say they're by any means unique organizations, but they have specific types of strengths and assets that we're hoping people will leverage. And so if you're thinking towards a trial, you're probably going to want to think long-term in terms of the relationships that you're building, because from the outside trying to run a trial within another organization, it's not usually possible unless you have strong collaborators who are already within those organizations who are also on board with the trial idea. So I would just sort of think about all those things together. So I think looking at both the scope and sort of where it's going, as well as the relationship building as sort of as key elements of the whole. Because I think that even if you were to generate some preliminary data, the question is that data going to be relevant for the trial if the trial isn't conducted elsewhere, right? And the answer may be yes, but it also could be no. And so thinking a little bit more long-term, particularly if you're not currently affiliated with the organizations, is a good idea. But again, maybe Chris or Catherine can help connect us after the call. I'm happy to have a more in-depth conversation about your specific interests and help you sort of navigate whether or not it's a fit for this particular call.
Okay, that would be awesome. And other piece of that, just really quickly, is I know you said about current MCC, but I also scholars, but I also know that the last round of applications are under review. So I wasn't sure if potentially if you're getting considered in that round, kind of trying to do all of this simultaneously. Would that be something that you recommend, or would you say waiting another year before you try for the pilot data?
That's a really good question, but I think it's probably unique to the individual. And I think it probably also is related to how closely affiliated you are now, or an individual is now with either of these organizations. But again, I'm happy to have that conversation offline, but I suspect it's going to be individually based. Liz, I don't know if you have anything to add to that, or if you have any other thoughts.
Right, I think it would be individually based. And I have received another chat question that seems related to all of this discussion, which is whether if the organization is not, somebody's university is not currently in either of these research networks, are there ways to apply to become an individual member? Both of these networks are organizational level networks and so they aren't set up to have individual members. But I think I would go back to Elisa's comment about seeking collaborators who may be already who may be already involved in either of these organizations. So either a university that's an OAIC or a healthcare delivery system that's an HCSRN member. I hope that answers that question also.
I received another question. Do we have to use data from either of the two organizations, or can publicly available data be used as well?
That's a great question. It hasn't come up so much because I think the data from these organizations often tends to be a draw for people. But I would say potentially you could use other data resources. But I think you would still want to leverage some of the assets of the organizations in terms of the strength of the application. So for example, perhaps you are leveraging whether the geriatricians within the OAICs as an expert in geriatrics. At the same time, maybe you're leveraging knowledge of learning healthcare systems from an HCSRN collaborator, and between those two sort of lenses, even if you're working with sort of not data that isn't stemming from either of those institutions, if you're still using some of these other resources that the organizations have to bring to bear, I think that would be a stronger application. If it feels like it is distal from sort of the strengths of the two organizations, I think it's just going to be harder for the reviewers to sort of consider that, in terms of the specific criteria for this particular pilot. We do want you to leverage those resources, but I would say my gut says that the resource does not have to be data specific. It can be some other resource, but I don't know if Liz or Jerry have anything to add to that. But that would be my inclination, is to say yes, but make sure that you are leveraging some resource from either or both of these two organizational sort of entities.
I think that's fair enough. There may be situations where the organizations has obtained access to data that is not from that organization. Say an OAIC department has access to a federal Medicare data set of some kind that can be used for a study. I think that would be considered an asset, a resource of that OAIC department or university. If they have already purchased, say, a Medicare data set, then that would be considered data that could be used. So maybe that answers that question also, of the data don't have to be exactly derived from individuals in that setting, but they should use the resources of the setting.
Okay, another question, can the topic of the study focus on only one chronic condition in older adults, or does it have to encompass multiple conditions?
So this is Elise. I'm sure Liz will agree. So the real focus of our initiative really is around multiple chronic conditions. And I think we'd like people to focus on that in part, as I said before, because the vast majority of older adults have more than one condition. So, but at the same time, I think it's not hard to expand, right, at times into that realm. But I do think that where we feel like we're bringing something unique is the methods and the data and the thoughtfulness that goes into studying people with multiple chronic conditions. And so it's not enough to just sort of say, oh, and we'll also look at blank. I think we really need to be thoughtful about, sort of the research that's being done and making sure that it is considering the fact that someone has multiple chronic conditions as part and parcel of the research itself. And Liz, you might have some additional helpful advice here.
Yeah, I'd second that. The idea behind the MCC initiatives that have been fostered and sponsored by different funding organizations, and certainly as part of the aging work, is that having multiple chronic conditions is by definition having interacting issues as part of, interacting issues are part of the healthcare, the management of healthcare and the management of health for these individuals. And so that's part of the goal here, is to address those interactions. And so, for example, studying a population of people who have two conditions, but those conditions are unlikely to ever interact, probably would be less interesting to reviewers than studying a population of people who had interacting conditions.
And this is similar to a previous question, but just to confirm, in order to, are co-PIs acceptable if only one is affiliated with the HCSRN or OAIC?
I would think, at least tell me what you think. My feeling is that it's probably worth writing a letter that outlines what the goal of the planned collaboration would be, and the reviewers of the letters of intent could certainly consider how a collaboration might be formed. The core of the collaboration is about the HCSRN-OAIC team. Elise, do you want to add anything?
Yeah, no, absolutely. I mean, I completely agree. So the the way that this particular call is set up is a PI must be affiliated with either one of these organizations, again, as Liz has said, so that we can leverage the resources of both of those organizations. That doesn't preclude having a co-PI who's not within those organizations, but I think Liz's point is a good one in order to just sort of reassure everyone that there's a plan here, there's a specific plan for how the external investigator is going to be meaningfully involved in the work, and what sort of everyone brings to the table is always a helpful thing to do in any grants application. And I think the same is true here, right? Because the NIA has funded us to really sort of merge together and sort of leverage the strengths of both of these large networks. And so to do that, obviously, we want to tap into the individuals within those networks. So just making sure that that's a key theme, but then also sort of if there are individuals who are not within the network, that they can be part of the team, but that we should probably explain exactly sort of how these individuals will collaborate together, particularly in such a short time period. Remember, this is a one-year project, and it's a relatively limited amount of money. So for I think anything we do, and when that's the case, we really need to explain how those resources will be used and how the project is going to be completed in a timely manner and successfully based on sort of the team that you have, where they sit, and the resources that are going to be leveraged towards the project.
And I believe that's all the questions I see in the chat and Q&A. If anyone else has any questions, you can type them now, or if they come to you later, feel free to reach out to us by email.
Thanks, Chris and Catherine, for organizing this, and thanks everybody for calling in. As Chris said, don't hesitate to get a hold of us if you have questions.
And as you sign off, you'll be prompted to complete a brief survey regarding any thoughts or opinions you had about today's webinar. Your comments are incredibly helpful to us as we plan our future webinars, and so please, if you do have a chance to review, to answer that quick survey, we'd really appreciate it. Thanks so much, everybody, and happy holidays, and have a great day.